Dr. Alan Grill, Chief of Family Medicine at Markham Stouffville Hospital in Ontario. Good to see you, Dr. Grill.
Good afternoon.
What do you think we're going to get from the WHO?
I think your guess is as good as mine in terms of whether they're going to change the declaration that COVID-19 is a public health emergency of international concern. I think the message that I'm taking is whether they, change the declaration or not, it really isn't going to impact sort of my life that much, either today or tomorrow. We still have a pandemic on our hands. We still have people that unfortunately are dying of COVID-19, that are being hospitalized with COVID-19. We have people with long COVID who are having symptoms for weeks or months at a time. And we still have a lot of people who haven't been updated on their COVID-19 vaccinations, despite the fact that they're free in Canada. They are readily available. So, you add all that up and then you look at lower income countries who have the same problems and don't even have necessarily the same surveillance funding that we have here at home. You still have a big problem regarding the pandemic. We're not in the same place that we were in 2020. We've obviously come a long way, but I don't want the public to take whatever announcement comes today, and if it's a downgrade, to say, well, the pandemic's over. Like, it's definitely not over.
So you would say it's not time to lift the emergency declaration in your mind?
No, that's not my decision. I mean, you have a committee of experts with training at the World Health Organization. They use very specific criteria to determine whether they need to change the declaration or not. But I think the message still here is that, especially in Canada, we still have to promote vaccinations. We still have to let people know that masking indoors is important. We still have to let people know that there are frail, elderly, and immunocompromised people that are the highest risk of still getting COVID-19, even though we have definitely seen a reduction in the number of cases, primarily based on the fact that we have a lot of vaccinations and we have a lot of people that have had COVID-19 at one point in the last 3 years. But that doesn't mean we can just say, oh, it's over, we're done. And, coming out of this pandemic as we move forward, there's still a lot of issues in the healthcare system that need a lot of attention. We still have a health and human resource staffing crisis. We still have people who can't find a family doctor in this country, which is really a shame. And, we still have a lot of delayed surgery. So even if the pandemic, as it rolls along, continues to improve in terms of the overall risk, we still have a lot of recovery to do. And so, again, regardless of the announcement today, I still don't think it's going to change some of the things that I'm working on, some of the messages I'm going to be giving my patients. And again, we'll wait to hear what the WHO has to say.
Dr. Grill, we appreciate you taking time for CTV News as always. Thank you.
My pleasure.